Welcome back to What the Fertility Season 2. Today we are sitting down with Katie Griffith discussing all things related to IVF and a thin lining. Katie reached out in hopes to share her experience with a stubborn thin lining during IVF. She hopes to shed some light on different treatment methods that can help with thin lining, as during her own journey she felt resources were far and few between. Welcome, Katie.
Thank you guys. Thank you for having me.
We are so excited. I know, especially because we really haven't. I mean, I think we've maybe briefly talked about thin lining, but nothing like in depth. So I'm so excited to hear, everything that you've done. And I think you're just going to be a great resource for people.
Yeah, I definitely hope so, because I feel like in, my journey and kind of trying to do quote unquote research on Instagram and other places, I just haven't come across a lot of people who have had as thin of a lining as I do, and like kind of what they have done and tried. So yeah, hopefully maybe I can be that person for somebody else.
Yeah, I love that. We haven't released it yet, but we had a guest come on that did have thin lining, and we kind of like probed a little deeper, and she didn't know how to explain it. So I think people that do go through thin lining also just don't understand all the different treatments, unless it's just like this persistent thing that's the barrier to success.
Yeah, and I think honestly, and we'll get into it, but I don't know that there's much that can be done about it, is kind of what I found out. So
wow,
has been my experience.
Let's
Yeah.
get to it.
Yeah, let's hear how it all started.
Yeah, we'll give you the floor. I'm sure there was something that triggered your infertility prior to finding out you had thin lining. So why don't you go ahead and get started?
Yeah, so my husband and I, Tyler, it'll be 5 years in May. And so I want to say it was probably 2 years after we got married, I think, is when we were finally like, okay, like we want this, we're ready. Let's kind of start trying. So prior to that, however, I actually got diagnosed with an autoimmune disease. It's pretty rare. It's called neurosarcoidosis. It's essentially inflammation of abnormal cells, and it's in my cervical spinal cord. So just kind of dealing with all of that and some of the things that happened because of it, I had just this inkling, feeling that getting pregnant was going to be difficult. So that was kind of always in the back of my mind. I actually stopped getting a period about 2 years before I got diagnosed with this disease. So we don't know if that had something to do with it, but I'm just going to assume that it did. So we decided, what was it? August of 2020, I stopped taking birth control, and, periods still didn't show up even when I got off birth control. So we met with an RE in February of 2021 and, did the initial blood work, the HSGs, all the different testing that you do when you first get started out with a clinic. So we found out two kind of interesting things with that. One, both Tyler and I are carriers of something called, the abbreviated version of it is PKU. It's a strange word to say, but basically, since we're both carriers, our children would have a chance. I want to say it's like a 25% chance of, being born with that disease. And it's pretty serious. I won't get into a ton of the details there, but it's a pretty serious disease. So, we kind of wanted to be able to screen for that. So found out we'd have to do that. And I actually have a picture of it. I know people on listening won't be able to see, but we did an HSG, and I don't know if you guys can see this.
Yeah, we can.
But do you see that tiny little triangle?
Yeah.
That was my uterus.
Wait, what?
What?
Yeah. So this is the test where they shoot in the saline and make sure your tubes are open, which mine were, but that's what filled up for my uterus.
Oh my gosh.
Which is like
maybe we'll ask for a screenshot of that, because that is mind blowing.
Yeah.
I need more. Yeah. I need a lot more details.
Yeah, I'm like, what? I've never seen that.
Well, and my RE hadn't either, and she was like, I'm really concerned about the size of your uterus. And, we kind of went way back to my teens. I had an eating disorder when I was young, like many young women. And she thinks maybe it was just like from lack of estrogen exposure. I don't know. But so she was like, we need to look more into this before we do anything, because if that's how small your uterus is, there's no way you can carry a child.
Yeah, Katie, wait. So I guess verbally, are there dimensions? Like, do you have like, it's like 1/16? Well, yeah, like, is it like 1/16 of the regular size of, I mean, it looks so tiny.
Yeah, extremely small. I don't have dimensions, unfortunately. I'm sure maybe she had given me some, but
the fact that she had never seen it in her career seems like,
Yeah. So she actually referred me to, so because of my autoimmune condition, I'm kind of a regular patient over at the Mayo Clinic here, which actually is kind of nice because I was able to get in pretty quick with somebody over there to do the hysteroscopy. Yes. So I got scheduled for that. And the first one, they scheduled me to do it without anesthesia. And it was horrendous. They couldn't do it. I like nearly passed out. So we had to reschedule so they could put me asleep.
Yeah. Well, that's so interesting because like it's already small. That's so crazy.
Yeah. So that was a fun experience. So we ended up doing the hysteroscopy. They put me under, and she did say that while it was smaller, that the uterus, like we don't know how it's going to react, like when it potentially would get pregnant. So she wasn't overly concerned. So we decided to move forward with me being on estrogen suppositories for like 3 months. I think it was a whole summer, just to see how I would respond. Yeah.
And over the summer too, that does not sound fun.
Yeah. I don't know what other people's experience has been with it, but just as like I just felt kind of crazy, like emotional, sensitive, irritable, like not to mention their suppositories. But
exactly.
I hated how I felt. But that's what I felt like, we needed to do to see what happened with my uterus and then with my lining as well. So I didn't really respond. Like my uterus responded to the estrogen. She did see a change. She was happy with that. So we decided to move forward with an egg retrieval. So this was in August of 2021. So did a retrieval. I responded really slow to the medication, but by the end of it, I think I stemmed for like 12, 13 days. But we were able to get, I think it was 21 that we retrieved, 15 of those fertilized, and then only 3 made it to blast, which was, kind of disappointing. And then we sent them off for both the PGTA and the PGTM testing because of the PKU, we ended up with 1.
Did the other 2 have the PKU?
So 1 was just totally abnormal. 1 would have had the disorder.
Interesting.
So that embryo is still frozen, but I don't foresee it something that we would ever use, but she's frozen for now. I know. So yeah, but during the retrieval, your lining's still supposed to respond, and mine didn't. So that was kind of disheartening. But we decided to move forward with an ERA because I definitely wanted to do that. We only had 1. Like, let's do an ERA. And that also, is kind of prepping, the same prep you do for an FET. So it's like, okay, let's again see how my lining responds.
Yeah.
My lining never got over 3.5 millimeters.
Wow. That's like baseline for a lot, right? A lot of people. Like,
yeah. Really thin. I feel like the people who I've heard have, thinner linings, it's, closer to like, at least they get to at least like 6.
Yeah. Because what is it? Is it, okay, it's been a while. Is it like 12 millimeters or is it over 8?
I think 7 to 8, and then they want it to be trilameter, which they could barely even see if it was trilameter because it's so thin. It's really hard to tell. Okay. So we had those results, and it was like, well, let's try. I should say I tried estrogen patches too, when we were prepping for the ERA, because I had only done the suppositories and oral estrogen. So she was like, let's see how you respond to patches.
Yeah.
And obviously that didn't really help, and those are pretty expensive.
Oh, are
Especially
they?
when you're putting on like 4 a day. Like I think I probably spent
goodness.
over $800 on patches
Just for
Wow.
like a
when
couple
all is said
weeks.
and done. Yeah.
Wow.
Yeah.
I
I
didn't
mean,
use
my
them.
insurance doesn't cover anything, so
Geez, I didn't use them, but I have heard like with either failed transfers or the trying to get like a thicker lining, they always like just say like try the patches. So you did the patches and the pills at the same time?
yes.
Oh,
Yep, we just loaded it up
Oh,
yeah,
with
I'm sure you
estrogen.
go crazy.
Yes. Yeah, I did. So then we had the ERA results, which I was 24 hours pre-receptive, which my doctor was also kind of like, let's follow this, but also I'm wondering, is it saying you're pre-receptive because your lining's still so thin?
And yeah.
Like,
It's
she's
just
like, I
not
don't,
ready. Yeah.
yeah, yeah. So we decided I had asked her about something I'd read. It's a PRP infusion. You heard of that, I guess?
Yeah, so they use them like, so I work in healthcare, so they can use them like with
Yeah.
orthopedics, right? Like injection. Is it
Yeah, like tons of
stem
different
cell?
stuff.
That's cool.
Or no? They like
So
yeah, go ahead.
so basically what they did is they draw your blood and then I think they centrifuge it. One of those little spinning machines.
Yeah.
And then they inject that into your uterus.
Oh,
That's so
I
I've
know.
only done it as a
I know.
facial. Have you guys heard of it as a facial? That's the only way
I've
I
seen
know.
it. Yes.
Like the vampire facial. I've done it that way, but I've not obviously in my uterus.
Yeah.
Interesting.
Yeah. So you can, and she'd actually never done it before. So she was like, well, yeah, like if you were willing to be my guinea pig, let's do it.
Can we back up? Did you bring
Yeah.
that to her? Did you bring that suggestion?
Yes,
And where did you
I
find that?
did. Just online, like Google searching, and I'm sure maybe somebody on Instagram. It's been a while, so I can't remember exactly, but yeah, I was just trying to
And it was supposed
figure
to
out
help
what people have
your
tried.
lining. That was the whole point.
Yes.
Okay.
Yeah.
Okay, final question on this, and I'll let you keep going.
Yeah.
So I hear you say inject into your uterus, and I think like with a lot of treatments, that's just like through like not like I don't know how to explain this. That's just like external almost to extent, but do they like physically have to go in and inject into the lining of your uterus?
Yeah. Well, no.
Okay.
No, so I wasn't like being poked with a needle injected or anything like that.
Thank you.
Yep. It's I think they call it a PRP infusion because I think it'd be similar to, how they do the saline into your uterus for that scan. I think that would probably be similar.
So it just like absorbs it up.
Yeah, I guess.
Okay.
I guess. So they have you do that during your like FET prep. So when I would go in, and they'd kind of monitor me, and you could do it 1 to 3 times depending on how you respond. And not surprisingly, I didn't respond. I got up to 3.8 millimeters, and we did it 3 times. So
wow. Is it expensive?
So I forget. I think she ended up like, because I was the first person, I think she like gave me a discount.
Sure.
But I think normally it's around like 1,500 to 2,000. So, I mean, at the end of the day, what's another grand?
I hear it. I get it. Yeah. Okay. So that did not work.
So that did not work. And she was like, it's up to you. Like, we can transfer and see what happens. She's like, but I give you about a 10% chance of it working.
Oh my gosh.
And I kind of,
you already had like, you basically were ready to transfer, right? When you identified it hadn't worked.
Yeah. So, sitting there in her office, I was like, I just want to do it. Like, I was just so ready. Like, I just want to transfer, and I went back and got in the car with my husband because obviously, still COVID, they can't like come in with you, which is frustrating because it's like, then I'm, you're trying to like communicate to your husband all this stuff that I don't know. That just was always frustrating for me. But anyhow, I went out and I was like, this is what we're working with. And he was like, we don't have to do it. And I was like, I'm just like, we'd spent a whole year, like getting ready to do this. And we ended up agreeing that like, no, like we need to give this embryo the best chance we just need to cancel.
Good for you. I think that would be
Yeah.
so
That would be
difficult.
so hard.
I thought you were
It
going to say you
was.
did it because that's
Yeah,
probably
me too. I was so ready for you to say that.
I know. I wanted to so bad, just like, I don't know. But
patience.
I'm
No,
glad
that's
that,
amazing.
yeah. No, I'm glad Tyler had the like level head to be like, we don't have to do this. Like, we still frozen, like there's no reason we have to. Like, we hadn't tried everything as far as the thin lining, like so the next thing we would do is called a Neupogen wash. And Neupogen, I think it's honestly some sort of like, I don't know if it's like people with cancer use it. I don't know.
I've heard like in the infertility community on Instagram, like I've heard this, and I don't know.
Yeah.
Maybe while you keep talking, I'll look it up.
Yeah. I kind of forget exactly what it is, but so we scheduled me for another FET and to do this Neupogen wash with the prep to see how that would respond. So, and I should mention, this is like right before Christmas time, and we were traveling back to Iowa, where we're from, for a wedding, like in between all this. So I'm like traveling with my progesterone shots. I'm hyped up on estrogen. I'm like totally
oh my gosh, no,
a hot mess. And we're like traveling back and forth. We had travel issues that just like added to it. So I am like not okay at this point. Like
Sure.
I just feel crazy. And we're getting ready to do this, start this next round, get ready for an FET. And I just don't feel good. Like not only like mentally, but I am not feeling good. And I am like, I know what this is. This is the neurosarcoidosis that I have coming back. Like, and I was like, this isn't good.
Yeah.
Oh no.
So I ended up we were literally the morning we were supposed to go in for my first monitoring appointment before we started the FET, and I was like, I am sick. Like we can't do this. So I called her and I was like, look, as much as I want to move forward, like I've got to figure out what's going on with me and get healthy before we do anything else. So yeah. I had an MRI at the end of the year and I was right. Like the inflammation was back. And so what I have to do when that happens is I get on, have you heard of Remicade?
I haven't. Is it like an is it like suppress your immune system?
A lot of people with RA, I think, take it too. And I think even like Crohn's disease, but it's infliximab technically. And I go once a month for an infusion. So I spent most of this year doing that and kind of taking a pause. So,
oh my gosh.
Yeah.
I really appreciate you sharing that because I feel like, gosh, we're in like episode 40 and I feel like every time we talk to other women, there's like it's just life. Life just happens.
Yeah.
All of that. And like, you're like already so ready before this hurdle. And now, I mean, that's a big deal. Again, your body has to be super healthy, and inflammation, Amanda can relate, she has lupus. So that's
right.
autoimmune, and inflammation affects pregnancy.
Oh, absolutely.
Oh yeah.
And you have to listen to your body. So I mean,
yes,
I know how bad you wanted to go to that transfer, but you have to listen to your body.
Yeah, which I'm glad, like silver lining, right? With, health problems, you know your body and you know when something's not right. And I'm glad that I have that knowledge and knew to kind of take a pause because, it probably it wouldn't have worked. So, and I should say, just not to jump all over the place, but from the very beginning, of visiting seeing my RE and just all the thin lining stuff, the small uterus, from day one, she was like, would you ever consider a gestational carrier? And I was like, no, like if I can't carry my own baby, like, must be a sign. No, like, I don't know how we could ever afford it. Like, that just sounds crazy.
Yeah. With reoccurrent loss too, it was like gestational carrier because I thought my body couldn't do it. And I think it's like one of the most expensive options out there.
I mean, it's really wild. So I was just like, no. And even before I got married, I said I'd never do IVF. So
right. Oh, I get,
Yeah.
oh yeah. There's lots of things I said before and things my husband said before you actually are faced with the decision.
Yeah, it's crazy. But the reason I mention that is because, not spoiler alert, but we're kind of getting to that point because, my lining, we've tried nearly everything and nothing's responded. I have lingering symptoms from my autoimmune disease. It's basically the lower half of my body I have a lot of like numbness and tingling and not like full strength. And sometimes that even gets into like my lower back. And just even thinking now about like being, 6, 7, 8, 9 months pregnant is kind of scary because, I walk perfectly fine and all of that, but I don't have like full grip in my feet. Like when I wear slide sandals, sometimes they slip off because I can't hold on to them. So just like the safety factor, even when I would be like, if I could ever get pregnant, is almost kind of scary. And you don't know how your body's going to respond when you have an autoimmune disease. A lot of times they say, and I don't know, Amanda, if you can kind of speak to this, but I've heard that during pregnancy, a lot of times you're like better, but then afterwards things can come back like tenfold.
Yep. 100%.
Yeah.
So that was like the biggest thing for me. They were like, okay, when you are pregnant, you're going to like feel the best.
Great.
Everything's going to, oh my gosh. And I did. And it was wonderful.
Oh yeah.
And right at the end is when my lupus flared and then I got induced even earlier. And then after I was on prednisone, I was like, I had to do steroids and everything because it was flared. Yeah.
Oh yeah. Yeah. So, just all these things, it's like, maybe we do have to consider this gestational carrier situation. I don't know how we're going to do it, financially, but
we haven't posted it yet, but we do have an episode with a guest that used the gestational carrier. So I'd love to connect the two.
Oh, yes. That would be amazing.
Yeah.
But so in the meantime, while I'm like, doing these infusions and getting myself healthier, which I am today, I feel great. But we decided to start looking into it and just talk to a couple agencies. I'm like, at the very least, let's just get educated. Like, let's start learning about this, what it looks like, how people pay for it.
The cost is like $150, right? Like the average median. Yeah. Have you heard of, I don't want to go off on too big of a tangent. I'm dying to get the CEO on our podcast. It's like called, it's like a program. It's a gestational carrier program. I think it's Stork something. A man created it. Him and his husband used it because they used the gestational carrier.
Okay.
Let me find it and send it to you and link
that'd be great.
Because I think it's a phenomenal resource. And I'll send you the podcast too, because he walks through his whole process.
Great. That'd be amazing. Yeah. Because there's so many out there and, a lot of them they offer so many things. And I guess for me, it's like, I wanted to find someone, me and Tyler wanted to find an agency that handles a lot of it because I'll just totally micromanage the whole process. And I have a full-time job that I need to like focus on. I can't have this other job. So, and I guess I'll just share the one that we really like so far is Circle, which I know is a big one. I'm sure people will be familiar with them, but we've met with them a couple times and we're going to meet with them again on Friday. But they handle everything. Awesome. Like they have the lawyers, they have the social workers, they do everything. So that's appealing to us.
So it's called
Circle. Yep. And they have a podcast too.
Oh, that's cool.
Yeah.
We'll tag it.
Is it called the Stork's Nest or no?
Maybe. I know we're both trying to look it up right now, which we shouldn't be. I'm just like, I think gestational carrier, like, and I'm sure Amanda doing like embryo donation, I'm sure you had considered it too. It's so overwhelming because of the cost.
Oh, it's just wild. Yeah. When they break it down to you, for the most part, it makes sense. So there's so many people and things involved with it. So, but there has to be a way, I don't know, there has to be a way for it not to be so expensive
Yeah, because
someday.
you're ultimately paying for a round of IVF, then you got to pay for the transfer of somebody else, all of their work.
And that's not even included. That's not even included.
God.
Yeah.
Last comment on this, and then we will move forward. Do you follow, I'll send it to you, Jacqueline Mish? She was on the Survivor.
I feel like maybe I've seen her.
Survivor. She has her son now through a gestational carrier, and she actually went through a very, very lengthy process, which is another topic about like her carrier had a miscarriage at 23 weeks. And so like that's a whole other thing to consider.
Yeah, like right. And just like with IVF, I think when we're naive and we don't know much about it and getting into it, and even people who are far removed, like IVF doesn't guarantee a baby, and neither does surrogacy.
No, exactly.
So that's just something to think about too. But so with that said, we've talked to a couple other agencies too, but when we shared that we have one embryo, they were very much like, we highly recommend you try and get more. Because, pay all this money and you only have one, there's a very good chance that just because she's a surrogate or gestational carrier doesn't mean it's going to work the first time. So we decided I got finished up with my infliximab Remicade infusions the end of October. So, because I wanted to be, again, healthy and also off that medication before we did anything else. So we had our egg retrieval in mid-December, and I did do a little bit different of a protocol because we were like 15 fertilized and only 3 were blasts. Like that's a pretty big drop.
Mm-hmm.
Yeah.
So my doctor recommended that we added, is it HGH, the human growth hormone?
The Omnitrope? Or no?
Yes.
Yes, we did that too.
I think
I did that as well.
Yep.
I think you actually wrote, yeah.
Okay. Yeah. So we did that. And I actually, the first time I had done Menopur, and this time we did HCG instead. So those things were different, which who knows if that helped or not. But I kind of the same thing, responded really slow, but was stemmed for 12 or 13 days. We retrieved 15, 12 fertilized, 9 were blasts, which was like,
that's crazy.
so exciting. Yeah. And they actually, so we had flown home to Iowa for Christmas, and literally 5 minutes after we got off the plane, this was like December 22nd, they called and they were like, we have the news about your blast. And I was like, oh my gosh, they're going to ruin Christmas.
I know.
And she was like, 9. And I was like, oh my gosh.
You're like, are you sure?
Thank goodness. Yeah. Are you positive? Did you call the right patient? But so we had 9 blasts, which is just,
amazing.
Awesome. Because really, I was just like, if we can just get 2 more, then we'll have 3. And then, that at least gives us a great chance for 1, child. So we finally, the PGTA and that PGCM testing took like 3 or 4 weeks for whatever reason. So we ended up with 3, which is wonderful, but still like big drop.
Yeah.
And actually 2 of them, like we would be able to transfer, but one's a low mosaic, which I don't really know much about. But my doctor explained it to me just on Friday, and she said ours it's trisomy 14, which she doesn't honestly know a whole lot about. So we'll talk to a genetic counselor, but I mean, they prefer to not transfer a low mosaic.
I've never heard of trisomy 14
I don't know
either, actually.
Yeah, and I did my Google searching, but I didn't really find too much, to be honest.
But still, 3 healthy, good embryos.
Yes.
Plus that's incredible.
Yeah. So we're thrilled. And it just feels like for the first time, I feel like this might actually happen. Like I kind of have been I try to be a realist about stuff, but also be hopeful because you have to.
Mm-hmm.
But yeah, even when we went into our retrieval in December, I was just kind of like, okay, this is the last time we're going to do it. Whatever happens, happens. you know, just, I don't know, I was just so much more relaxed and just like no expectations, you know,
Yeah.
it was almost like we're just check this box, do another one, you know, whatever happens. So it just finally feels like we
Oh.
might actually have a kid. I don't know.
Yeah, since we're like 3 weeks into January now, so
Yeah.
are you kind of over like trying to get your lining to thicken and you're really focused on
Yes.
gestational carrier and you're going to use those 3 today
Yeah.
that you think of moving forward that way?
Yeah. That's kind of what we've come to. We've had, I mean, really 2 years to think about it and kind of, I guess, come to terms with it too. I guess I've sort of grieved not being able to be the one to carry. And that really bothered me for a while. I just feel like as a woman, that's like the ultimate experience. But at the end of the day, like, you know, my health is most important. And if there's such a small chance of it working anyway, like we worked way too hard to get these 3 embryos and they deserve the best chance that we can give them. So, you know, people take out loans for cars and for houses. And granted, most people don't have to for a kid, but we're just hopefully going to make it work.
Oh, I love that. That is awesome. I mean,
Yeah.
when I was considering it, my thought process was like, okay, if I can't have that 9 months, 10 months, but I could have the rest of that baby's life, like what, of course I will do that.
Yeah.
Right. Like I
Yeah.
will give up that experience to have babies in my future. So I definitely,
Yeah. Yeah. I mean, family is just really important to Tyler and I, and we have the sweetest nephews and niece that we just absolutely love. And it's like, yeah, so maybe I don't get to experience pregnancy and having the bump and all those things, but we're going to have our own special experience, hopefully with a great carrier who we'll have a relationship with. And it, you know, it'll just be a different, wonderful experience. So I'm just come to terms with it. And we're just very excited to kind of make a decision and get started, hopefully in the next, I don't know, soon.
I'm very excited for you. I'm going to send you all the people I know that.
Yeah, exactly.
Please
okay,
do.
we're gonna have a whole list of people for you.
Yeah.
That's so
Oh,
exciting.
that would be great.
So excited for you. That's, oh my gosh.
Thank you. Yeah, but it's crazy how long so Circle told us it can take 6 to 12 months to just match with someone. And I think and we don't have to get into the politics of this, but if someone's not vaccinated, COVID vaccinated, sounds like you match faster than if you want someone who's vaccinated, which again, we don't have to go into those politics, but that's really interesting.
That is super interesting. That was similar when I was active with adoption. Same thing with the matching.
Oh yeah.
Yeah, we actually couldn't even like some of like my husband. We don't have to go into it. But my husband's not vaccinated because he has an autoimmune disease and I am. So it was just like a whole
it just adds another layer, of course.
Does.
But
yeah.
But
okay, I'm super excited for you. So we
you.
got 4 little embryos, and so Circle, and I'm gonna send you the other ones. You've already given like really, really good advice to our listeners.
Oh, good.
I think just in terms of the thin lining and then just like changing your mindset of what the future looks like when you are faced with a different route. I don't know if you have anything else you want to add, but I think you've kind of touched on it.
Yeah, no, I think gosh, there's a lot I could add, but I think just as far as one, the mindset thing, like again, if you talked to me a year ago, I was not in a very good place, like just disappointed by everything that we'd been through. And I'm sick again. Like it was just very much like a why me, poor me, you know, just really felt like a victim. And I'm not sure what exactly like kind of turned things around, but you know, it's totally fine if that's where you're at with your journey right now too. And I'll just say like, you know, I don't know how or when, but it will get better. You'll kind of start to, I don't know, have that better perspective of, you know, why you're doing this all in the first place. And sometimes you just need a break. And I'm almost, again, these silver linings, I'm almost glad I got sick again because it forced me to like step back, take a break, have lots of time to think about what we wanted to do next. And I know during this process, the last thing we all want to do is pause or stop, but it was the best thing for me. So if anyone can take something from that, yeah, that would be great.
I can think of like 10 people that need to hear that right now. So thank you for sharing.
Yeah, of course. No, definitely. And yeah, I guess that's it. And I guess I do want to preface too, just because I know we were talking a lot about the thin lining and wanted to focus on that. I would totally encourage other people to try the things, to try the PRP, to try different forms of estrogen, to try the Neupogen wash, because people have clearly responded to it. I just wasn't one of them. So I don't want to suggest that those things don't work. They just didn't work for me. So.
That's awesome. I know I was looking up the Neupogen wash while we were talking, and the reason I had heard of it,
yeah,
I was going to do Braverman up in New York, and for recurrent loss, and they use that a ton. And it did.
Oh, okay.
It did relate to chemo patients. I don't know how, but it did.
Okay, I was like, I know there's some tie there.
I think it has something to do with white blood cells, but I was like, didn't want to read much into it while we were recording.
Yeah. No. But no, this has been great. Thank you guys for having a platform for people like me to come on and share. Honestly, this whole, I still listen to podcasts regularly when I walk. It's just great to hear other people's stories and experiences. So thank you for what you do.
Oh, thank you so much for being on with us today.